Tissue Center. We have a very important message that we'd like to relay to all of you about the need for blood, especially now that the city is opening up as well as other parts of South Texas. It's important that we keep all of you abreast of the need for blood and where we are with that in the community. The first thing I'd like to do is to say thank you to the community as well as our community leadership, including the mayor, the city manager, Judge Wolf, leaders throughout the community that have stepped up and said, we're going to help you through these challenging times to make sure that you have enough blood. Beginning on March 15th, we saw many of our blood drives cancel in order to protect employees, to protect our students, to protect members of our community, and folks essentially stayed at home unless they had a need to be out and about. And the folks that had a need to be out and about were our blood donors. And because of their generosity and that of other people in the community, we were able to keep up with the need for blood throughout our hospitals. We have over 100 hospitals and healthcare organizations that we support, along with about 75 pre-hospital assets that carry low titer O whole blood. And so all of you, all of our community throughout South Texas helped us with that. But now that the city is opening up, now that South Texas is opening up, now that the United States is opening up, and the non-emergency surgeries are being performed, and I have to tell you, when you're having surgery, every surgery is important and it's an emergency. But in the context of the situation that we were in, the non-emergency surgeries, those were postponed. And so now our hospitals are actively bringing those patients back in. We're seeing an incredible increase in the amount of blood that's needed. However, some of our city still isn't opening up at the same rate that our hospitals are. And what that means is that our access to that blood and to those donors is significantly limited. So what's happened in the last month or so as the city has opened up? Well, we're seeing that our need for blood has increased from about 300 donors a day to somewhere around 500 donors a day. And each one of those donors gives different types of products. Some of them will give red blood cells, some of them will give whole blood, some of them will give platelets, some will give plasma, cryoprecipitate. It just depends on what the need is in the community. And what we've found is with the increase in surgeries and with the increase of activity, which generates all kinds of situations, including an increase in traumas, an increase in the types of surgeries that are needed, because some people had to wait a while for their surgeries and they got sicker, that we've seen that increase for blood go up. So now we're needing 500 donors a day in order to meet the demand, not to build inventory, just to maintain our inventory. In addition, we've seen over 200 blood drives canceled this summer, which is the equivalent of 6,000 units of blood. 6,000 units of blood is essentially, if you take the whole month of June and you chop off the last 8 days, that's how much blood we would need that we don't have. It's about 45% of all the blood that we need for 1 month is essentially evaporated almost overnight. Well, where did it go? Well, as our city opens up, there's still many organizations, businesses, schools, churches that have limitations either to whether or not people are coming back to work or whether or not they're going to open up their campuses for visitors. And as vital as we are, we're seen as a visitor on many campuses. And so we can't have blood drives there anymore. And people are, they're getting busy again. And they're wanting to go and do things, and they're not putting giving blood as a priority. But I can tell you our patients see it as a priority. We want to be able to meet the need for blood each and every day. We never want a single patient or a single physician to have to worry about whether or not they're going to have enough blood, or worry about, is this patient going to get this unit of platelets, or is this patient going to get this unit of platelet? That shouldn't be something that happens here in the United States or in San Antonio or anywhere for that matter. However, that's what we're seeing. Right now, when we talk with our hospitals, we're having to tell them, we can fill this part of your order, but we can't fill that part of your order. And that's because we don't have enough donors coming in the door. I'd like for you to consider that giving blood is our individual responsibility to our community. We expect certain things to be available to us. We expect for there to be a police force that helps maintain our safety. We expect for there to be electricity and clean water in our community. We expect if something happens to us for there to be a first responder there to take care of us. We have these expectations in our community, and we should also expect that when we get to the hospital and we need blood, that that blood is there. But that is not possible unless the community responds. Throughout the United States, these shortages are everywhere. They're not just here in San Antonio. If you were to go to Dallas or to Houston or to Los Angeles or Seattle or New York City or Chicago, you will see these same shortages. It's not just here in San Antonio. If it was, I would ask them to help us, and they would be able to do that. But right now, they're in the same boat we are. So it's imperative as a community we come together and figure this out. So in order to tell this story, I think a little bit more succinctly, we've invited some guests here today. Some of them are representative from our hospitals here in San Antonio, and then we also have a family that's going to tell you a little bit about the story for their daughter who is needing a liver transplant, and her life depends on blood just about on a daily basis. So first I'd like to welcome Dr. Teresa Duran. She is the medical director for the blood bank at the Baptist Health System. So Dr. Duran, would you come up and tell us what it's like for you and your local hospital?
Hi, thank you for having me here today and to be able to share the story of our patients that we're seeing in the Baptist Health System. So we are seeing that many patients are coming back into the hospital for surgeries or much needed medical care that may have been put off during times of COVID. So this is putting an even greater need for blood on our blood banks. And so we are seeing this increased demand now that patients are coming back for treatment, like I said, that may have been delayed. At baseline, we take care of many different types of patients. So I just wanted to share some examples of the kind of patients that need life-saving blood. There are some patients that come in to the blood bank as an outpatient, and they are patients who have medical conditions that may not allow them to make their own red blood cells. So they are dependent. They're transfusion dependent. They depend on the blood that is donated through South Texas Blood and Tissue Center to be able to maintain, their life essentially. We also see patients that are presenting for surgeries. Again, more people are coming in for surgeries. And prior to them presenting to surgeries, the blood bank looks at this type of surgery and the blood type of the patient and makes sure that we have enough blood on hand for that patient for that particular type of surgery. And if we don't have that blood, then that surgery can't go on. So these people who have already put off their surgeries may have their surgeries even further delayed if we don't have blood on hand. Finally, we have neonates. Neonates are tiny babies, and what's neat about your donation for a neonate is that it can be aliquoted or divided into many different donations for that same baby. So one donation can be used for a tiny baby over and over. And then, of course, there's also emergencies or trauma that comes in, but sometimes those patients use many units of blood, and we always have to have blood on hand for those situations as well. So that's why we're here asking for the community to help make sure that the blood is available for these patients. And hopefully these examples bring to light some of the people that need this blood. And you may know some people who have been in these situations or are these types of patients. And so we're hoping that this kind of brings to light the situation and the need. And we have people come out and donate. South Texas Blood and Tissue Center is accepting donors with appointments, and they're maintaining social distancing. That way, when you come to donate, you will stay safe as you help to save others. Thank you.
Thank you, Dr. Duran. The need for blood it's 24 hours a day, 7 days a week, 365 days a year. It never ends. And COVID or no COVID, protest or no protest, it doesn't matter. Blood is always needed. And I think sometimes we think of blood as one of those things, it's like when people show up at the emergency room. But the majority of blood is transfused in not those types of situations. And the only way that the blood can be available for those people is if healthy people who are walking around today make appointments and come in and donate. Next, to share a different perspective, is Dr. Joy Swartz. Dr. Swartz is the Director of Clinical Pathology, and she is the Medical Director of the Blood Bank for the Methodist Healthcare System. Dr. Swartz, would you like to come up and share some of your thoughts with us?
Again, thank you for inviting me here today. The hospitals throughout San Antonio have been spoiled for many years. The wonderful employees at the South Texas Blood and Tissue Center and the amazing blood donors in and around San Antonio in the past have provided us with a wealth of blood products. But sadly, times have changed. Since the beginning of the COVID pandemic, large organizations have canceled blood drives, and individuals are nervous about getting out and donating blood. During the past few months, hospitals were allowed to perform only emergency surgeries, and just recently, however, they've been allowed to perform elective surgeries. For example, hernias can now be repaired, total knees can be replaced, hips can be replaced, and many other types of surgeries. These surgeries, however, cannot be performed without an adequate blood supply. Although blood is used daily for our surgery patients, it is also life-saving for our cancer patients, our transplant patients, our accident victims, burn patients, both young and old. If an adequate blood supply is not available, difficult choices will eventually have to be made regarding which patient will be able to have their surgery or have their life-saving blood transfusion. We want to urge organizations not to cancel their blood drives and encourage other organizations to actually hold blood drives. Statistics show that approximately 25% of us or more will need blood at least once in our lifetimes. What could be more valuable than to spend 15 minutes of your time during your day donating blood? It is perfectly safe to donate blood. It is an act of kindness and compassion. One donation can help save the lives of up to 3 people. It is truly a selfless act, and the fact that you are healthy and can do it should be its own reward. Plus, if you donate now, you will get the results of a COVID antibody test to let you know whether or not you have been exposed to the virus. Again, thank you, and please go out and donate. Thank you.
Thanks, Dr. Swartz.
Thank you.
Dr. Swartz, you're absolutely right. The kindness and compassion of a single individual can impact 3 patients' lives. And when I know that there's a lot of people who watch these live Facebook feeds and our press conferences, and I would just say, when the next time you're around your family, you're around your friends, you look at the people that are around you, and if 25%, so that's 1 in 4, needs blood, think what would you do personally if that person that you loved or cared about needed blood? What would you do personally? Well, you'd overturn heaven and earth in order to get enough blood for them. Well, there's people out there right now that need blood, and we need to make sure that it's available for them. But again, it's the community that supplies that. So next, I would like to ask Dr. Max Braverman, who is the clinical instructor in trauma and emergency surgery at University Health System, to come and say a few words about how blood is important for his line of business and in the trauma centers.
Good morning. My name is Maxwell Braverman, and I'm a trauma surgeon at UT Health San Antonio at University Hospital. I think you've heard a lot today about the importance of blood transfusion in our community, For us as surgeons, we are seeing an increasing number of elective surgeries that are now being performed, and that has required blood transfusion. But for my line of work specifically, and for my partners and our partners at BAMC as well, life is really going back to normal. And since Memorial Day, we've had an uptick in traumatic injuries across the spectrum of presentations. And as those patients present, they have put more of a strain on the blood banking system. At university, we're specifically low on O-positive red blood cells and O-negative red blood cells and platelets. In some cases, we've been able to take whole blood, which we use for our sickest, most urgently needing bleeding patients, and use those to supplement some of those products, but that's not really an ideal scenario. In addition to that, as you've heard, we've had a lot of patients with chronic medical conditions who have come into the hospital for care. Many of them have tried to stay home as long as they could because they didn't want the risk of being exposed to COVID, which is understandable. We are doing everything that we can to make sure patients are safe. But a lot of those patients are showing up in more dire need than they would on a normal day outside of this pandemic. I've had the experience in my career of taking care of more than one patient who has had such significant injury and such significant bleeding that they've needed over 100 units of blood products. That's not the majority of patients, but those patients do show up, and we do need that blood in order to keep them alive and save them while we operate. A patient like that at a time like this puts a critical strain on our system, and we don't want to be put in a situation where we have to decide whether or not we can give additional units of blood and blood products to that patient because there's also a community need. For me and for trauma surgeons around the country, blood is really essential. First of all, it's used to replace blood that's been lost, but really, more importantly, it's used to keep patients alive while we operate on them and stop the bleeding. And that's a very dynamic process. Like I said, we don't really want to be put in a position, and we hopefully and ideally will not and have not in the past, and hopefully never will, be put in a position where we have to make those critical decisions. We plan to proceed and will continue to treat all of our patients, but we have a unique dynamic relationship with the community as physicians. We're always there. We're always there to help. We're here to take care of everyone that shows up, but we really rely on you, the community, our corporate partners that are able to hold blood drives to deliver the majority of our blood. We will always be there. We also donate, but we need this partnership to continue and appreciate any and all efforts to really increase the blood supply across San Antonio and South Texas. Thank you for your time.
Seventy 70% of all of the blood that is collected in the South Texas area, which is about 48 counties, comes from businesses, schools, churches, community organizations. We have 7 donor rooms where people come to our donor rooms and donate, and we're very fortunate to have those facilities available for people to come and donate. But when you think about 70% of all of the blood that's collected for our patients in our hospitals was essentially collected out in the community rather than right here at Donor Pavilion or in Chavano or in Southeast or in Victoria. It's out in the communities. And so not to have access to those campuses, to those pools of donors, put a significant strain on the blood supply. Luckily, there were organizations that stepped up and said, we get where you're at, and we want to provide space for you to collect blood donors. One of the places that stepped up very quickly and continues to step up, and actually stepped up before COVID, was Ingram Park Mall. And so at the malls, we can go there. We have a huge space where we can social distance, we can run blood drives, and that's wonderful, and we really appreciate that. But we need more of those. We need more organizations to say, we understand, and we get that it's a difficult time for everybody, but we're going to work with you in order to have enough space so that donors can come and they can feel comfortable. Having said that, we need more help. And the reason that we need more help is because there's patients that are going to need a lot of blood, and we want to make sure that they have that blood. We have a patient story here. We have the parents, Jeannie and Tim Hill, here to tell the story of their daughter, Hagan, who is waiting for a liver transplant. Their story, while it's heart-wrenching, it's not uncommon. There are too many stories like this out there about young folks that are waiting for liver, lung, heart transplants. There aren't enough organs. And when there are organs available, we as a community have to make sure that those transplants can be supported by an adequate supply of blood. So Jeannie and Tim, would you come up and please tell us a little bit more about Hagan and what challenges y'all have today?
First of all, we'd like to thank the South Texas Tissue and Blood Center for allowing us to come here today to tell our story and a little bit about the journey of our daughter, 20-year-old now, Hagan Hill. And she's had some health issues, but it's been a long journey for her. And throughout her medical history, she's had multiple blood transfusions, and several instances have been significant in keeping her alive and having her here today with us. She's waiting a second transplant as we speak. But as we talk about her, and we're going to talk a little bit about her journey to get here, she was a vibrant young child in elementary school. She won literary awards. She was published for doing an environmental book in elementary school that was published. She was published in a couple of poems that she wrote with other children that submitted poems and short stories that have been published. She's an artist. She is very creative. She's very intelligent. She ended up graduating from high school with 103.75 GPA while dealing with her medical history or medical issues along the way. And with that, I'm going to let my wife, Jeannie, elaborate and tell you a little bit more about her journey.
Thank you for allowing us to be here this morning to share Hagan's story. Try not to break down. Imagine kindergarten. Our child was 6 years old. She became very ill. We didn't know what happened. Took her to specialists. They did numerous tests. Really didn't know what was going on. We were referred, at the time we were living in Knoxville, Tennessee, we were referred to Cincinnati Children's Hospital, where we later found out that she had autoimmune hepatitis. And after having time with medication and she was non-responsive, she was told 2 years after she was diagnosed with autoimmune hepatitis that she had primary sclerosing cholangitis, which was heart-wrenching because we know that there's no cure for either one of those diseases. Doctors decided she needed to go on a liver transplant list. She was deferred at that time in Cincinnati, but it just so happens that we were moving to Texas in July of 2012 with hopes of a liver being here. Hagan was listed January 2013, and in September was the scariest month. September 18th, 2013 was the scariest day of my life. My young daughter projectile vomited bright red blood from esophageal variceal bleed. I panicked, had no idea what to do, consulted our book, and we rushed to the ER. At the particular ER we went to, we were later transferred to Dell Children's, and then we had to be airlifted to her transplant center, which is Texas Children's Hospital. At that time they received her, she was in the PICU for a week. She received multiple transfusions. Had she not received that life-saving blood, she would have bled out. She would have died. Doctors told us, obviously, after the fact, but that was so scary. She was so pale. But when she received those life-saving products, you could see life coming back to her. There was pink in her face where it was ghostly white. After we got out of PICU, a month later, in November, she received her liver transplant, which she did need blood products at that time as well. 6 months post-op, she did go into rejection, and they discovered her liver disease was back. We had a few good years. There were her freshman year to her junior year. She was fairly healthy for a transplant patient. That's saying a lot. Then Hurricane Harvey came through August 2017. That summer, right before her senior year, Hagan started getting very ill. She unintentionally lost 20 pounds. Went to the doctor. They said, get to the hospital immediately. We were unable to get to her transplant center, which was in Houston. Hurricane Harvey was raining down, flooding the city. So thank God we were able to come to San Antonio. University Transplant Center was life-saving to her. Her hemoglobin and hematocrit levels were at critical levels. She had to have 4 transfusions over the course of a week. She had multiple transfusions, and we later discovered she had ulcerative colitis as well as her autoimmune hepatitis and primary sclerosing cholangitis. That may not mean a lot to a lot of people, but it meant even more to us because that meant Hagan was losing blood, and she needed more blood products available to her. Unfortunately, her disease progressed, and she was now placed in December 2018. She was placed on the liver transplant list again, where she has been. She is dual listed for Houston at St. Luke's Hospital, as well as University Transplant Center here in San Antonio. We're trying to optimize her health. We're working with doctors as well as nutritionists to get her as healthy as possible for that procured liver, or even trying to work with Dr. Claire for a partial liver living donation. Those surgeries will not and cannot take place if blood products are not available. Think of it if it were your loved one and they needed that life-saving liver or heart or kidney. You would want them to live. So we are pleading with the community to please step forward. If you are healthy and able, please step forward, because you may need it yourself someday. Thank you for allowing us to speak about Hagan.
Thank you, Jeannie. I can't even imagine standing at a podium and telling a story like that. I can't imagine it. And Tim, it's like my prayers and hopes and wishes go out to you that donor is soon, whether it is an organ donor or it is a partial donor. I hope that's available soon for your beautiful daughter. And these are pictures of her up here. And I believe that the community is going to respond and that we're going to have blood for her. I do. So what do we need from the community? Well, first of all, We need for each and every one of the community members, whether you are an individual donor or you are a leader in our community, you're a physician, whatever role you play, is first of all for you to understand that blood is not something that giving blood is not something that somebody else does. It's something that we do if we can do it. If we are healthy, that's what we need to do. It is our commitment to each other to help our community grow and expand and be healthy that we make that commitment to donate. The other thing is that the part of our communities that run our organizations, that run our business, that are economic drivers, that are our faith-based organizations, our schools, our colleges, when we reach out to you, we're not doing it because it's business as usual. It's because it's life as unusual. Every time someone needs a unit of blood, it is a 911 event for them. It's not like taking an aspirin or an antibiotic. This is something that's very different, and their very lives and their ability to go home and be with their families and participate depends on those life-saving transfusions. We're doing a number of things in order to encourage people to donate blood and to say thank you for donating blood. The first thing is that for every person who donates blood, so it has to be a blood donation, there has to be a transfusible product at the end of the blood donation. We are offering free COVID antibody testing. This is not the rapid test. This is a specific, very sensitive clinical test that we're using that is over 99% accurate. And we're doing that because we believe that the community wants to know if they've come in contact with COVID. But we also, once we get those test results, which take about 14 days to get them back to you, we hope that if you test positive for the COVID antibody, that you will be willing to help us help a patient in a different way with convalescent COVID plasma. So we're recognizing your donation by providing that test. Another thing is that we have a local partner, Jordan Ford, who is donating a 2-year lease on a Ford Mustang. And so any of you that want to sport around in a cool looking car for a couple of years, and you can pick whatever your color you like. My personal favorite color is red. So if it was me, I would do red, but I can't enter because I work here. But hopefully there will be somebody out there that will win, and you can pick whatever color you want. We've received a lot of support from our mayor, from Judge Wolf, from many other people. But unless we get more support from the community, the summer is going to be very, very difficult, not only for South Texas Blood and Tissue Center, not only for our physicians, but more importantly for the patients who need blood. So please, if you're watching this Facebook live post, if you're part of the media and getting the story out to our donors and to our community, remember, this is a community effort. Much like staying at home in order to protect each other from the COVID virus, we did that together. Giving blood is an action that we do together. And so with that, I'll close and say thank you for your time and listening to our stories. And if we have any questions, I'd be happy to answer those, as well as our physicians and our guests. Are we having any questions come across? Are we good? Are we cut? Okay, just want to make sure before I step away and say something. All right.